Tena Koto, Korke Aho. Hello everybody, my name is Kay and I'm a member of the LIANZA Conference Committee for 2021. I hope you're having an enjoyable day and you've had a restful break. Through the session, please input your Q&A into the right hand side of your screen and Ruth will come back to you later on. I am proud to announce Ruth Carlyle. She is a health librarian and a health promotion specialist based in the UK. She was the first information officer at the Motor Neuron Disease Association and then went on to information roles at the Multiple Sclerosis Society, the National Eczema Society and the Macmillan Cancer Support. While she was working at Macmillan, the Cancer Information and Support Services Network expanded from 37 services to over 200 local services, mostly developed in partnership with the National Health Service. So no mai hari mai, Ruth. Sit back and enjoy, everybody.
Kia ora. Welcome to this session on health literacy for thriving communities, a partnership approach. My name is Ruth Carlyle, and I'm one of the regional leads for librarians in the National Health Service in England. It was my very great pleasure to be approached to give this presentation. It's an opportunity for us to share what we're doing in the UK, but also I hope to start a conversation, whether during the conference itself or on social media or contacts after the conference, about actually what is the role of librarians in health literacy and how it is that we support thriving communities through our work. During this next half hour, I'm going to be talking a little bit about what health literacy is, why it's an issue and an opportunity for all library staff in all sectors, the scale of the challenge that we face in England and what we're doing about it, but also sharing some tips and reflections on health literacy techniques that you can use both at home and at work, and how it is you might build health literacy friendly services. So to begin, what is health literacy? Well, if we think of it from a World Health Organization perspective, it's the personal characteristics and social resources needed for individuals and communities to access, understand, appraise and use information and services to make decisions about health. So it's not just about individuals and individuals' skills. It's actually about all the social resources that we provide as a community, and that includes libraries. And it's about having the responsibility to enable people to access, understand, appraise, and use health information. And these are skills that very much tie in with the roles that we play as librarians in the different sectors we work in. So there are three broad types of health literacy. So this goes back to work by Don Nutbeam back in 2000. And he stated that the first of the forms is what he described as functional health literacy. So can you find it? And then in terms of using it, can you do things like read an appointment letter, work out what time you need to be at your appointment, or follow simple instructions on a packet of medicine? We then get to interactive skills. And this is the bit that may be slightly different from the areas that we normally cover in our roles as librarians, because it's actually about how it is you extract the information that you want to use for a particular conversation to help you to make a judgment in relation to a shared decision about your care. And then the third level is critical health literacy. And this, again, it goes back to our critical thinking skills and so on that we share with people. So who wrote it? Is it in the right format for an individual? Is it up to date? Would you trust the source? So the basic critical thinking and appraisal skills that we do on a day-to-day basis, but really applied specifically in a health context so that people can make those decisions. Now, Don Nutbeam suggests that these are cumulative skills and that you need to have functional, interactive and skills in order to get the critical skills. It may not work quite like that in practice, because in many instances, later studies suggest that actually your health literacy general level, your general confidence goes down at a point of diagnosis, just with the shock and the difficulty in terms of understanding information. So who may need support with health literacy? Well, there isn't any one type of person who needs help. Actually, it's not about making assumptions in terms of who needs help, because we all need it at different points in time. and healthcare professionals need it as much as members of the public. And I'm sure we've all had instances when, for example, we might not quite have understood what a doctor said, and you say yes to be polite, and then you realize that you've actually said yes to something that you hadn't quite heard. So there's that for all of us, there's that element in terms of health literacy can vary, and that actually we need support. So it's a case of offering to everyone, and particularly at a point when somebody might be in shock and their health literacy might have gone down. Therefore, it's always a case of offering help rather than making any assumptions. And if you do have a decision that you weren't happy with in terms of your health literacy, it has huge ramifications. So we have misunderstandings. So where it is that actually it wasn't a shared decision at all, because the health professional and the individual had quite different understandings of what was happening. You can have a poor decision. So it may not be the right decision for you. It may be right clinically, for example, but actually you might have wanted to wait a few months before having surgery because you wanted to be able to walk down the aisle with your daughter. So there's all sorts of things in relation to decision making that aren't just to do with your health. They're to do with your life and your own choices. Often it exacerbates inequalities. So the people who have problems accessing health services are often the same people who have problems accessing health information and making good decisions that are right for them on the basis of it. It can lead to inappropriate use of medication. One of the classic things that tends to come up, for example, is how you describe how you might use a throat spray, for example. And sometimes people say that you spray it on the throat. Well, they mean down the neck, down the throat. They don't mean on the side of the neck. And it's very easy for people to get confused, particularly at a point of stress, and to use the medication in completely the wrong way, just because it hasn't been described in a way that they understand. It also means that you have inappropriate access to health services. So people may not go as soon as they need, or they may go too late. And ultimately, that actually people don't have the health that they could have. So you have poor health outcomes. So health literacy itself has huge ramifications for individuals and for communities in terms of support people need. And as librarians, well, why should we and any members of library staff make this a priority? Well, actually, fundamentally, if you think about health literacy, it builds on what we're already doing across all library sectors. Fundamentally, to be health literate, you need to build on some of the literacy and numeracy skills in schools. And then above that, you have your information literacy, your critical thinking skills, your how accurate is it, do you trust the source skills that we cover in all sectors in terms of libraries. There's also digital navigation. So can you find it online? Can you use it online? Certainly with the impact of the pandemic in the UK, we have had a significant number of voluntary sector organisations or charities that used to produce paper, printed information, who can no longer afford to do so because of the impact on their fundraising activities. So most health information is now online. And if you can't access online, then actually that has significant ramifications. So we play roles in terms of supporting digital navigation, digital champions and other roles within libraries. And those are the underlying pillars on which health literacy builds. So it all relates to our core skills, really. And if you think about the core skills that are shared by library staff across sectors, I've talked a little bit about health literacy and the John Nutbean model, but actually it's pretty close to some of the things we're already doing in other ways. Now, there are a range of different models you can use for information literacy. This is a particular one that comes from Cambridge. And looking at it, you've got things like resource discovery, so can people find it, critical assessment of the source, managing information, once you've found it and stored it, can you get it back again, creation and communication. So they're all information literacy skills, can relate quite closely to health literacy. And then once you get to the digital world, now this is the model that we use in Health Education England, but various others adopted elsewhere. There are elements about digital identity and communication, but also it come again back to the teaching and learning, information, creation, and some elements about technical proficiency. So they all relate quite closely to what we think we're doing on a day-to-day basis as library staff. So I would suggest that actually health literacy is our business. If you look at the blue circle on this slide, actually, those are all the elements that are really covered by information literacy. There's a core thing that's covered by libraries across different sectors. The only areas that might perhaps be a little bit of an outlier from that are, if you're thinking about digital literacy, there are some things about digital identity and technical proficiency that are not absolutely core to information literacy, but many libraries are covering them because they want to help people with their digital skills. And then if we look at health, well, the bit that's slightly outside our normal comfort zone possibly is interactive literacy. And I'll be covering a few of the tips and techniques that you can use for that and apply it within your own activity. So that's basically health literacy. And what's the scale of the challenge that faces us in England? Well, actually, it starts really fundamentally with how many people can read. So if you're thinking about the impact in England, which is a part of the UK in which I'm based, sadly, 1 in 6 adults in England struggle to read. Now that has huge ramifications in terms of health information, which is mostly based on text, words. So we have just over 16% of adults in England, or over 7 million people, who have what are described as very poor literacy skills. So they struggle to read information from unfamiliar sources or on unfamiliar topics. And if you're looking again at the relationship with information literacy, which we covered on the last slide, there's the sense from UNESCO that actually information literacy has become a basic human right in the digital age. And yet many people are actually excluded because they can't read or they struggle to read. So that's the printed word, the text. Once you think about it in terms of online, now the UK is slightly larger than England, so you've got Wales, Scotland and Northern Ireland in the UK. So this is a slightly wider figure, but 9 million people in the UK cannot use the internet unless they have help. And 6 million adults actually can't turn on a digital device. So you have significant areas in terms of words, the digital navigation, before you start getting to the health specific examples. So we now add health. Now our figures actually aren't very different from the figures in New Zealand. We just present them slightly differently. So in New Zealand, it's 56.2% of adults who find it hard to access, assess and use health information. We actually divide it slightly differently in terms of being based on words or words and numbers, if you look at the English example. So if it's just words, so texts without numbers, then 43% of adults aged 16 to 65 struggle to understand. Now, we don't think that actually magically as soon as you turn 66, you become much more health literate. It's just that we don't have any data for the 66-year-olds and over. But 43% of the 16 to 65s struggle with the words. When you add numbers, that rises to 61%. So that's the majority of adults aged 16 to 65 struggle to understand health information where it has both words and numbers. Just think about that. Most of the health information that you use has numbers in it. The number of tablets, the number of times a day that you need to find something, the time on a clock, they all involve numbers. And as I mentioned earlier, at a point of shock or a diagnosis, your health literacy goes down. So those are the national figures, but we also have local variation. So one of the things that as Health Education England we invested in was what we describe as borough level geodata, so local community geodata. So we can look at the different health literacy levels in different areas. And the variation is significant. So the best case scenario is South Cambridgeshire, which includes a university you might have heard of, the University of Cambridge. So our best case scenario, when you have both words and numbers in terms of percentage of the population that can understand the health information, is just over 46%. If you look at the worst case scenario, then it's an area in the east of London, our capital city, which is Newham. which has a very mixed population, a lot of people for whom English is a second or even third language, and nearly 82% of people struggle with health information. So a significant variation through. And in many ways, that reflects the underlying inequalities that we have in England, many of which may actually reflect the experience that you have in New Zealand. So we have coastal inequalities, rural inequalities, and also very, very mixed picture in terms of the urban. So this is a map that's based on our underground or tube map for our public transport in the London area. And it shows in the circles and the different stations, if you like, what the life expectancy is in different areas. So in London, our capital city, in the course of travelling 6 stops on the underground system or our metro system, your life expectancy can go up and down by 11 years in the local populations that you're living within or work travelling through. So that's a significant issue for us. Now, we are working with a large population, so a total population of over 68 million. And we have, in terms of our National Health Service as our main health provider, nearly 1.2 million people. So whatever we do as health libraries has to be in partnership with others, because otherwise we wouldn't be able to spread the engagement. So I work for Health Education England. Our role is as the strategic lead for National Health Service, or NHS, Library and Knowledge Services. In the National Health Service, we have roughly 1 million decisions made every day. I say roughly, actually it's more like 1 million decisions every 17 hours. And our aim is that those decisions should actually be based on evidence, and that people should be able to use the right knowledge and evidence at the right time. And that includes not just the members of staff, but actually members of the public. And therefore, we want to make sure that we work with partners in community settings to help members of the public to make better decisions. So working through local partners, so community libraries, schools, etc., then we hope we can actually achieve more. So if we're thinking about our National Health Service and the libraries that we have in health, we have 183 libraries and roughly 1,200 members of staff. If you spread it out to our local communities, there are 3,060 public libraries. Now that's significantly more. There are also nearly 6,000 school libraries. So again, if we're talking about working as a community, we can have much more impact at a local level through working through partnerships. So what we hope through working with others is that as an intermediate outcome, people who are information providers, so that might be a prison librarian, a public librarian, are aware of health literacy and able to use basic skills and techniques and share them with others. And strategically, actually what we then hope is that the public will be better equipped to make better decisions, so that actually citizens are engaging with the health service at the time that's right for them and in ways that are right for them. So our community partnership will actually be based around local and national work. Because if we're going to integrate health literacy into local activity, there are some things that it's better to do once, and also some things where it's actually better to learn from what works at a community level and share that, rather than everybody doing different things at a local level and then not working out actually what would have been most effective in that area. So partnerships in terms of integrating health literacy into information skills training and within libraries themselves, working in terms of development of digital champions with health literacy skills, and incorporation into what we describe as universal offers for public libraries. So the offers that all community-based public libraries make to members of the public. So some of what we do at a national level is about developing resources. So resources develop once that can then be shared, and giving momentum to their usage by demonstrating how you can use them. So just as one example, we tend to refer to 3 questions as an approach to be able to have a good health conversation. So what are my options? What are the pros and cons of each option for me? And how do I get support to help me make the decision that's right for me? Significant elements through, but not necessarily the easiest language. So work that we're doing at a national level is working with people with learning difficulties in terms of an easy read version, not just of the 3 questions. but actually of how it is that you might prepare online to have a consultation, in person for a consultation, using the questions. We then also do training resources and make sure that at a national level, we build the training resources once so that they can be cascaded. So some of the training is literally a train the trainer type model to make sure that other people are able to train. Some of it's about making sure that we've got health literacy awareness, full day training, shorter 1 hour training, 15 minutes, just literal introductions, and then e-learning as different forms of resources. And the training that we've been doing, beginning with things like public libraries and college and education libraries, but also pharmacies, so our chemists on our high streets, voluntary sector organisations, and prison libraries. We have the peculiarity in England that actually you don't legally have a right to access a library when you're in school or in a local community, but legally you do have a right to access a library every day if you're in prison. So working through prisons with that particular population, many of whom also sadly have low levels of literacy and numeracy, is a good way to help people to prepare for when they leave a prison environment. So that's what we're doing. But there are things that actually you can incorporate into your practice, some of which may be very simple, some of which may be much more about longer term partnership development. Fundamentally, the things that are slightly different about health literacy from our information literacy are to do with the interactive literacy skills that we talked about earlier. So I'm going to share with you a couple of techniques as takeaways for you, but also some reflections in terms of what it is that you might do for further learning and how it is that you might ensure that your own library service is health literacy friendly. So the first of the techniques that we tend to use is teach back. Now, teach back is actually about how it is that you make sure somebody paraphrases back to you their understanding of what it is that you've just said. It isn't about did you understand that? It's much more, can I just check that I've explained it clearly? Can you just tell me what it is that you've just understood? Or what were you planning to tell your family or your partner when you got home about the conversation? Or what next steps do you think you're going to take? So you've got some understanding in people's own words of what it is that they're planning to do. So as the communicator takes responsibility. It's about the responsibility of the person sharing the information to be understood, not the person with whom you're communicating. It's about the tell me, the space in which you give somebody time to be able to feed back to you what they've understood. It's actually re-explaining as needed. So allowing a bit of time and then continuing a cycle of explaining through until both parties are happy. So it's not about the skills of the listener, it's about the skills of the communicator and how they share information. And often it's used alongside another health literacy technique, which is chunk and check. Now, ideally, communication is much easier in small sections. A long lecture, a keynote speech, whatever it might be, is not necessarily the easiest way to take information on board. It's often much easier just have a short section, check the understanding, and then give the next bit of information so that people aren't having to take in a huge amount. And particularly, as we mentioned earlier, because people may well be in stress, in shock at a point when they're having to take on board health information. So they actually need to have a bit of time, a bit of space. So if you're interested in developing your skills around these techniques and others, or sharing them with members of your team, then we have a free 35-minute e-learning program, which you can use. And you can then share that with others in terms of those skills through. And I assure you, you do not need a National Health Service email account to be able to access it. It is accessible to everybody. Just then thinking about your service. And what I'm actually going to share with you relates to health literacy, but also information literacy a little more widely as a checklist and some things to do. So we found in terms of working, particularly within the National Health Service, but also with partners, that much of the health literacy friendliness of a service goes back to the written communication about it. So how it is that you actually describe the service, how it is that you make sure people know about it. So it's partly having user testing with your users of your library service in terms of how you describe things, but also having a policy that you will test with users and that you will make sure that actually it's appropriate to people's needs. There's then spoken communication. So having guidelines to staff to offer support, to use tools such as the Teach Back and the Chunk and Check to help with communication, and offering help just as a matter of routine, rather than making assumptions about who might need it, because we will all need it at different points in time. There's then whatever stock you choose to hold. So having information materials in different formats, whether that's Braille or whether that's in terms of different sign languages, or signposting to that information so that people can find it when they need it. And the same applies to resources in different languages. There's then the signage. Now, I don't know what your libraries are like, but I can definitely say that in terms of some of our National Health Service libraries, the signage is quite appalling. Finding the library in the first place is quite a challenge. So a regular review of the external signage to make sure that people can find the library in the first place is always useful. And it certainly ties in with the health literacy friendliness of the service. And again, testing that signage. Did people find you when they expected to find you? Training. So offering training to staff on health literacy awareness, just so people are aware of the facts and figures in relation to health literacy and what it is, and training as appropriate in terms of roles in relation to health literacy skills. And then just incorporating it into your policies. So you may or may not need a specific health literacy policy, but there's something about making sure that whatever policies you do have for your library reflect those hints and tips through. So thank you for listening to the stories that I was sharing in relation to our experience. And in England specifically, but actually there's something about this is a global issue. So New Zealand's at the centre of a wide range of different issues across the globe in terms of health literacy and in terms of making sure that people understand information. So I hope that during this conference, you'll use social media and other opportunities to share your own stories, your own ideas in terms of perhaps how conversations could be better and how it is that you might use techniques. You might also consider joining the International Health Literacy Association, again, so that you can share ideas with other people. Oh, and the Teach Back and the Chunk and Check tools that I shared with you, now they can be used in all sorts of different circumstances, which could be about your own health, or it could just be for a clearer discussion with members of your own family. So thank you for listening to this keynote presentation. If there is any further information you would like about the work that we're doing in England, then do feel free to read our strategy, which is Knowledge for Healthcare, and you can see our contact details here. If you use the email address on this slide, then you can get back in contact with me. I'm Ruth Carlyle, and you can find me at Health Education England. Together, we can make a difference, building healthy, thriving communities which have health literacy at the heart of them, so that people can make better decisions for their own health and for that of their families. Thank you.
Hello again. I hope you enjoyed that keynote. Wow, I love the takeaways. Kia ora, Ruth. Don't forget to come back and check the feedback to your Q&A. Have a great day, everyone. Ke pai te rā. Bye for now.